Okay, today we're going to be going over pharmacology in the OR on the sterile field. So, you can have sterile water administered to you on the sterile field. Again, home makeshift, so this is what we've got. They come, typically it has blue writing on it for sterile water. It has a label on it. You would pop the plastic label, and then your inside liquids are sterile. You also could have normal saline or sodium chloride 0.9%. It would come the same way in a bottle. It's usually a liter bottle with its plastic wrap on it. You'd pop that and you'd open it up, and that's how you would administer it onto your sterile field. Your medications come in vials. You can have excuse me, your 5 milliliter vial, 50 milliliter, sorry, and your 10 milliliter. And you also have powder that comes sometimes, which you would have to reconstitute on or off the field, which we will talk about in the next video. Okay? And you also have ampules. This is how they would come. When you're getting ready to use them, you would pop the plastic off, and it reveals your rubber housing, which we're going to use this one today because it's a little older. Okay? This would always get wiped with an alcohol pad. And when you're taking from an ampule, because it's glass and when you open it, there could be little fragments that get in, you would use a blunt filled needle with a filter. Let's see if we can get it to, there you go. Okay. This one has a little purple hub on it. If you're just drawing from a vial, you would use a normal blunt filled needle, which is all red. Okay. When you're handing off for injection, you would use hypodermic needles, different sizes or gauges, different colors, and they all have different lengths as well. Okay. So you can see they're different lengths, and the different gauges, it would go by pretty much the thickness of it. Of course, we're not going to get good pictures on here. But your blunt fills, as you can tell, they're much thicker. They have wider openings. Your filtered one, this would be your filter. And this filters out any particles that are inside. Your blunt fill standard is just that. So filter would be with ampules or anything that could have particles if you need to filter out for specific injections. Blunt fill if you're going to draw from the vial itself. Okay, now we're going to move over to our syringes. There's two types of syringes. You either have your slip tip syringe or your lower lock syringe. Okay. Your hypo needles fit onto both. Slip tip is just that. It would slip on. Sorry, one-handed. It would just slip right on. It's not as secure because it could just pop right off. Your lower lock, you're going to take, let's see. You see how it has little clips on it? This is what's going to slide into. You seat it on just like that, and then you twist and it slides down. Okay? That's how you would attach your hypo to your syringe. Now we're going to draw medications from a vial. If you only need a certain amount, Then you would draw from the vial. So you would take your syringe with your standard blunt filled needle. You would take the cap off. Your circulator is going to establish with you the name of the medication, the strength of the medication, as well as the expiration date. Okay? The top would get wiped off with an alcohol pad. They would hold it up for you, and then the surge tech would puncture the plastic portion, draw back the amount that they need. So here we only need 5. So the tech's going to take 6, just so that way when she primes, it'll work. Okay, and pull out. And that's it. That's how you would draw from a vial. Now we're going to draw from an ampule. It's a solid glass container that has your medication inside. As you can see, it gets trapped, so sometimes you have to tap it, tinker with it in order to get all the liquid down where it needs to be. Again, you need to find out the name of the medication, the strength of it. Where is it on here? This is just 1 milligram of epinephrine, and the expiration date is, sorry, it's tiny on here. Super tiny right there. Took my eyes a second to find it. Okay? When you open an ampule, you want to take a gauze pad. You're going to take the gauze pad, you're going to hold it over the top, and you're going to snap. We do this for safety precautions because this is glass. You don't want any glass shards to cut you. Okay? Now, when you draw from an ampule, if it's on the sterile field, you would open it yourself and do everything that way. If it's off the sterile field and you need to obtain the medication from inside, the circulator would open it and hold it for you. You would take your syringe with the filtered blunt needle, remove the cap, and they're going to hold it at an angle for you. You're going to put your needle in slowly and draw back, making sure to get everything that's in there. Okay? And then you would prime it by slowly pushing up to get all the air bubbles out. All the way up. Right there. Good job. Next, we're going to administer the sterile solutions onto the sterile field. We have our scrub. We have our sterile back table. And I'm the circulator with the sterile solution. So your saline or your sterile water would go usually into your large basin if that's what you're using. Again, we're going to pop our plastic seal. We're going to show the scrub that it's saline, and the expiration date is 7/2022. They've acknowledged it. And now we're going to open it. And standing away from the field, not reaching over it, I'm going to pour the full contents of the bottle. If you pour anything less, as you see, it drips out, so now it's running down the unsterile outside of the bottle, which means if I went to re-pour again, all the unsterile particles would then be in the field. So key point, do not reuse sterile solutions. Okay? When you transfer medication to the sterile field, it's typically going to go in a medicine cup. And again, the circulator is going to show you what it is. So it's 9% sodium chloride, so 9% would be the strength. the expiration date. And then you would hold it out. So from this angle, you can tell that she's still over her sterile field. I could administer it to her, but the safest practice would be to come to the side of your table. There you go. So I'm not leaning over it. And with nice distance, you don't want to be here because none of this is sterile. Your medicine cup is, your scrub is. So from an upward distance, you're going to pour the contents. That's how you'd administer medication onto the sterile field.